Brock, who are you coloring? My name is Nichol. I have 3 boys that keep me very, very busy. We do activities, we're busy with sports. In my teenage years, I would start noticing like when I was eating or after I was eating, it could be maybe even like an hour after I was eating, I would get this like burning sensation down in this area. I would also have this like really bad, like horrible, like upper pains in my abdomen. About 6 months ago, I had a really bad stomach pain. It led to me fainting and I ended up falling down the stairs, and we ended up going to the ER at Medical City Frisco.
When Lauren was in the ER, the workup leads to lab work, which usually comes back normal. Heart rate, blood pressure, all that comes back normal. But then they can do a CAT scan, which she ended up getting, and that CAT scan can evaluate the soft tissue as well as the blood vessels, because they give some contrast through the blood and it lights it up. What happens is the area where that big vessel that comes off from the heart that feeds the rest of the body, called the aorta, has this one trunk that's called the celiac artery. And then that median arcuate ligament is basically this muscle from your breathing muscle that compresses on it and decreases the blood flow to the stomach. Lauren has a diagnosis called median arcuate ligament syndrome. Another name for it is celiac artery compression syndrome. And so 25% of us can have it and not know about it. But the ones that become symptomatic from it actually are only 2 out of 100,000 people. So it is pretty rare. We use robotic technology that does little incisions and gets us in there and allows us to see and do what we need to do to release the muscle and the nerves to take the compression off the artery.
Today, I'm doing great. All the symptoms have subsided. When I eat, there's no burning sensation. Medical City Frisco has been amazing. I finally got the answers that I needed. I can move on with my life with my kids and just starting to feel better.